Hello, I'm Dr. Ruth Roberts, your pet's ally. I hope all is well with you guys. You guys have a few questions in here this week, so let's get right to them. We'll pop over to the Facebook page. And Becky is wondering, I think we covered this last week, but just to reiterate, we do still have, I think, 60 some jars of the cat holistic total body support available. And what I've finally figured out how to do is just mark it down to $5 a jar. There are some of you that have purchased it and paid more than that. I'll be going back through and giving you all refunds for those that you overpaid for here shortly. But they're shipping out pretty quickly. Again, this is the cat product, so it is safe to use for dogs. We use it at 1/4 teaspoon per 20 pounds of body weight. So there is that. And again, we should be getting new jars of holistic total body support back in stock mid-April. Jamie is asking about cooking the grains in the crock pot with the food. And, Erin's got you covered, add it in the last hour or so and make sure that, the rice or whatever you're using is completely under the liquid. Other people will start with adding the rice in right from the rip. Again, don't put it on the bottom because often it will burn, which is not fun. And then you do need to add some extra water. And then there you go. So that's kind of easy. Hope that helped you out, Jamie. And Erin, that is fantastic news about Mr. Mongo. So it's just a nasty old wart. So get it checked out and, work on controlling inflammation. So even though the wart is benign, it is still a tumor or an abnormal tissue growth. So that tells us that something is out of whack in your pet's body. And that's, I think, the best place to look is to start working on reducing inflammation as much as possible and improving immune system function. So things like probiotics, things of that nature. And the other thing I was going to mention to you all too, I don't know if you're familiar with the Tippins Protocol, which is, and I'll put the link to his website down here. But Joe Tippins is a guy that had really bad small cell lung cancer that was not responding to treatment. And interestingly enough, he was an alumnus of the University of Ohio and sort of was telling his story of difficulty on the alumni boards there, and a veterinarian told him to check out fenbendazole, which is a dog dewormer. At any rate, he said okay and started taking fenbendazole and vitamin E and curcumin and a couple of other things, CBD oil. And lo and behold, I think in something like 6 months, his cancer really pretty much disappeared. It was no longer visible on a PET scan. And his doctors had just given him sort of like, I'm sorry, this is all we can do. And he is still clear of cancer, I think 4 or 5 years later. So there's been a lot of discussion about using that for people to prevent cancer and also, in pets. And so I've been working on a protocol for the Tippins idea to use fenbendazole to treat cancer or prevent it in pets. And I've got a couple of consulting clients that we're trying that out on. But for those of you that are not familiar with this, the theory is that fenbendazole kills intestinal parasites by altering their microtubules. And this is like the holy grail of cancer therapy. By altering the microtubules in the cancer cells, they go into apoptosis, or normal cell death, and die. Now, he did everything together. So he kept on doing chemotherapy and did this protocol with the fenbendazole. And he says, probably I should have changed my diet too, but I didn't, and so here he is. So if you all are interested in that, let me know, and I'm pretty close to getting to the end of it. I tried it myself because there's some discussion, does it work for autoimmune disease, does it not? I did see some initial improvement, but then after that, no, not so much, and it kind of plateaued. And interestingly enough, we were in Mexico, so I am going for stem cell treatment myself next week to treat both this quasi-autoimmune disease that I have as well as a collapsed lumbar disc. So I'll keep you posted on that as well. But it's interesting, in Mexico they did not stop research on fetal cord, cord blood or umbilical tissue, which is where the most pluripotent stem cells are. And pluripotent is the big word because that means that these cells can turn into almost any cell. So I'll keep you posted on that as well. So Erin, awesome news. Let's see. The next one is from Sabine about using cups as measurement. And no, I think Sabine just cram them in the cup and go from there. I do finally have that video, the new Crockpet Cooking video, done. And excitingly, we are going to relaunch the members area so that it will be easier to use and that you will be able to use the iPets Ally much more easily as well. That will launch middle of the month. We're going to turn that into a subscription deal, and that's where I'm going to be doing these question and answer sessions going forward. So, just Sabine, I think we try to overthink it, and it really just isn't that hard. So just cut them, and you don't need to cut them into smaller pieces. Just couple of hand grabs, so really tight, and then go from there. With the leafy greens, instead of 1 cup, you want to actually use 2 cups, so you get enough stuff in there. I hope that's helpful. So I hope that makes sense. Let me see if there's some other comments. Yep. So we really just don't need to. Yeah, thanks, Patty. Don't overthink it. It really doesn't need to be hard. So whatever makes you comfortable, but basically it's not a big deal. Wow, that's interesting, Lolly. So Sita's asking if she's a bad mama, if she's buying pre-cut stir-fry veggies and using these in her meals. And no, that's okay. I mean, if that's what it takes right now for you to keep up, that's what it takes for you to keep up. And the broccoli, so here's the interesting thing about that. For years out of the human literature, they said, oh, this will cause thyroid dysfunction. Well, it turns out that that's not really true. I have seen patients where they do seem to have thyroid issues that become more difficult to kind of control, if you will, with high doses of broccoli. So I think that's where you maybe want to cut back a little bit, or use something like cauliflower instead of that. And so I think this broccoli toxicity thing is just really, really overstated, and it's more about Lolly, I don't agree with this. So there are, different phytonutrients and chemicals that can create issues, but generally if you cook them, it's not a big deal. So, I mean, I know plenty of bodybuilders that all they eat, sadly, is boneless, skinless chicken breasts and broccoli. And so literally, 30% of their diet is broccoli, and that has not created an issue. So I think it can create some gas and some GI discomfort, but I don't think that it is toxic. So this is pretty interesting what's out there. I mean, this is where I want you to really kind of think hard about, does this make sense or does it make sense? I think this is really bizarre. Go figure. And this is the other thing too, is that what we've all gotten kind of used to is all the things that worry us and scare the bejeebers out of us. So, you know, all of these things, out of all of these things, macadamia nuts and Brazil nuts, interestingly, are the only ones that are not, that are sort of toxic at any dose. And all of these are dose dependent. I mean, we all know Labradors that have eaten the Econo-size bag of Hershey's Kisses, and lived to tell the story and pooped out lots of tinfoil. If they ate a pound of dark chocolate, is that a problem? Yeah, it sure is. But I think so much of this is about fear and keeping us paralyzed and thinking too hard. It doesn't make sense. So I don't know where this doctor was getting the idea that 25% or more broccoli is toxic and deadly, because that certainly doesn't bear out. Is it bad to have 25% of your diet be constantly broccoli? Probably not a great idea. So hope that makes sense, Sita. But yeah, if this is what you got to do to keep it going, keep it going. And then, as I discussed today, then you can use these bags for poop bags, because that's exciting, instead of buying the plastic ones. So if you've already got a cellophane bag, instead of pitching it in the trash, then use it for something else. And let's see here. Iodine. Kay is asking about the Redmond salt. Yes, and it is a 1/4 teaspoon of kelp or seaweed to provide enough iodine per batch, and that's about 45 micrograms of iodine. So that's where I would go. Morton salt, Angie, you can use certainly the iodized salt, and the reason that we're sort of, again, so this is all fine points. The reason we're sort of dodging the Morton salt and other iodized salt and has either dextrose or aluminum silicate and all this other crazy stuff. And Angie's asking, now why would it have dextrose? And it's like, well, really, yeah. It's why do they put all this stuff in there? And it's because we don't like salt to cake up, and we don't like to be inconvenienced. It's the same reason that they put gels and gums in things like hot sauce, for God's sake. I mean, if you go to buy heavy cream, almost every container, even the organic stuff of heavy cream, contains gums. Why? It's because we want things to look perfect all the time. So, vote with your dollars and buy stuff that's not got added junk to it that doesn't need to be there. Hope this makes sense. Let's see. And then choose. Raw bones. I mean, that is just the best. If your dog is not like Mona and gets sick from the marrow, and your dog is not obsessed with bones and eats them until they fracture teeth and things of that nature. So what are other options? Aside from the chews, they are getting really expensive. And they, as Michael points out, they are not without calories. So, use the bones if you can. That really is the best way to go. You can use antlers. Mona thinks antlers are just passé. There's a whole things like cow hooves. There's all sorts of animal parts that have been turned into chews. But I think that getting a chew that they can chew on really helps with a lot of anxiety and things like that. So the gentle chew sticks. Let's see what these are. A lot of them actually are made from cornstarch, which is not so great. That's what a lot of greenies and things of that nature are. So, try to look at, okay, what is this actually made out of? And if that's a problem and you have a relatively small pet, then what I would consider is something like chicken gizzards, for instance, or relatively. I wonder what's in these suckers. It's always hard to find that on his site. Or golly, I don't know. All sorts of stuff. Chicken gizzards have been really helpful, especially for pets, for cats. They still don't list the ingredients. Where are they? Best selling. That's awesome. View ingredients. Let's take a look. So we have to really work at it. So what's in here? Brown rice, tapioca starch, pea powder, sunflower lecithin, citric acid, zinc propionate. So basically those are preservatives there. So that's a lot of kind of calories in there. So 3 kilocalories per treat. So that's not too dreadful. Yeah, 66 calories per treat. So they're pretty. And then, the other thing is just be cognizant. Is your pup sensitive to any of these things? So that's not too awful. But just be aware, everything is comes with a price, so to speak. So if that all works for your pet and that gives them something to chew and it keeps them from being less anxious, go for it. If it's something that, it's just adding weight on and you're worried more about dental care, then you can look at some things like toothbrushing. For older pets, that's often not possible. It's like that whole story of teaching an old dog new tricks. Sometimes it just doesn't work out that well. And the other thing is that if your pet has a 1/4 inch of tartar on its teeth, a chew is not going to help you that much. And that's where you really need to consider getting your pet's teeth cleaned if they are able to deal with having anesthesia, or if they are not, then doing something to alleviate the infection. Sometimes we can get away with scaling some of the plaque off. So I think Erin was using an anesthetic-free teeth cleaning, and that works great if your pup's willing to put up with it. And we were able to do that with Mona for a little bit until she was like, you ain't sticking that thing in my mouth anymore. And to be honest as well, if you're seeing a 1/4 inch or 1/8 of an inch of tartar on your pet's teeth, there is a good chance that there is something going on with that tooth, that it's diseased. There's an infection at the root, something of that nature. And really, you and your pet are better served to, get that checked out. Again, if it's possible to do with anesthesia, and have the teeth cleaned professionally, and then extract any teeth that may be diseased. And then that's where you can look at using some other things. Like there are plenty of sprays like the Liba 3 spray, when you're starting from a clean slate, that may make it a bit easier. So that's what I have for you today. We will have more news about the relaunch of iPets Ally coming up, and that's what I've got. So until next week, have a great week, and we'll talk soon. Remember, your pet's best health starts in the bowl. Many thanks.